Fears are growing about a so-called triple-demic, with hospitals across the country filling up with flu, COVID, and RSV patients. The CDC says flu hospitalizations nearly double week over week. So I want to bring in Chief Innovation Officer at Boston Children's Hospital and an ABC News medical contributor, epidemiologist Dr. John Brownstein. Doctor, thank you very much for being here. What do you make of these new warnings from health officials? What should people do if they have the flu? And what just in general people need to know right now?
Well, Trevor, this is really concerning. We are seeing striking flu activity across this country, and this is really unusual and concerning. And this is likely due to a few reasons. One, population immunity. We've been indoors, not gathering for over 2 years, and this ultimately is causing surges because people have not been exposed. So we have reduced immunity. We've also had something called viral interference, meaning that we've had so much COVID that in some ways our immune systems were already being so active that it didn't allow for flu to spread in the community. Also, I think there's something intrinsic likely about this new flu strain. And so while every flu season is different and it's hard to predict how bad it's going to get, we are already at record numbers. So I expect things to get worse before they get better, entering into the holiday season, which is often a super spreader event, unfortunately.
And we also don't want to take our eyes off the ball with COVID, too. I mean, almost half of the U.S. states are seeing higher COVID-19 risk levels, according to the CDC. What does that mean in terms of how COVID is spreading right now? How alarmed should we be?
Well, I'm alarmed about COVID too. We're seeing this rise in cases, especially post-Thanksgiving, which, again, a lot of people moved around the country, got together, and now we're seeing this rise in COVID cases. We're seeing hospitalization numbers now going because of this BQ 1.1 variant. So we're seeing these both flu and COVID surges happening simultaneously. Makes me really worried for our hospital systems, especially as we enter into this holiday season, which will then again create more opportunities for surge. But we have a reduced amount of immunity in the population. We don't have as much flu shots as we want in our arms. And of course, those boosters for COVID are also problematic.
Is the hospital system prepared for these surges?
We aren't, Trevor. The reality is we're used to an annual flu surge, but beyond that, we're really not structurally developed enough to handle RSV, COVID, flu, parainfluenza, all these other viruses happening simultaneously. We need to think about our health systems going forward. How do we do a better job forecasting risk? How do we do a better job thinking about new technologies like telemedicine or how to bring care at home? We have to think about the data and use it effectively because our health systems really are on the brink, and our physicians, nurses, they're all exhausted after these last 2 years. So what this next few months is going to bring is going to be really concerning. We're already, at capacity. So layering in flu and COVID on top of everything is going to be really challenging for us to handle.
Just no rest for the weary. Dr. John Brownstein, thank you very much for your time. Always good to talk to you.
Thanks, Trevor.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.